Everyone's Dr. Morales again. Wrapping up a whole series for the month of patient educational videos on plastic surgery topics. This question is specifically about breast augmentation, and that question is will I have permanent changes of nipple sensation after breast augmentation? So in theory, the nerves that are associated to the breast, sensitivity to the areola specifically, and the nipple, are coming from both the medial aspect or the middle part of the breast, as well mostly from the lateral part of the breast. And that's where the nerves are most often damaged, is on the side of your chest. So the surgical technique needs to be very precise. It needs to be done by a board certified plastic surgeon who understands anatomy and very familiar with the augmentation. And if it's done correctly, you should not have any issues with permanent changes in nipple sensitivity or numbness or hypersensitivity, anything like that. In the early, usually within the first couple months, there are some sensitivity changes, maybe a little bit more very hypersensitive or maybe a little bit numb, just from the stretch. The implant is placed underneath the muscle and there's a stretch of the nerves. And when nerves get stretched, they don't like being stretched and they have these sensations that may occur, but they're very temporary. It's very rare that I've encountered women who've come in for second opinions that they've had permanent changes in nipple sensation or maybe in hypersensitivity. So I hope that answered your question. Hope you learned something, and thank you for following.